Good morning, Merced High. This is Laura Gray, the club president of Rotaract here on campus. And next week, we're bringing you the Purple Pinky Project to help eradicate polio. Many of you may not know what polio is. It was a much greater concern for the generations before us, however. Polio is a highly contagious disease that is crippling and potentially fatal. It attacks the nervous system and causes paralysis of muscles. Victims may suffer anything from a case of an impaired limb to the complete inability to breathe on their own. Polio is irreversible and has no cure, but it can be prevented with a single dose of an oral vaccine. One vaccine only costs about 60 cents and can save the life of an individual and help stop the spread of the disease. In 1985, polio was still spreading through 125 countries. Today, it is only left in 4: India, Pakistan, Nigeria, and Afghanistan. In the near future, we hope for a polio-free world. Students, staff, and teachers, all we're asking is that you come out and donate just $1 during our Purple Pinky Project. Also, help increase awareness by getting your pinky dyed purple, just like those who have received the vaccine and are protected from this disease. With just this small contribution, you can make a difference. We're saving the world, just one pinky at a time.
Thank you, Laura, and thank you for introducing the topic. Hello, everybody. I'm Joyce Graff. I am the district chairperson for Polio Plus in Rotary's District 7910 in Massachusetts. It's always good to hear young people who are willing to work to eliminate a disease off the planet that she herself has never faced. She did her research and she wrote a nice paper on polio because she cares that her children and her grandchildren will never have to face polio, no matter where they travel, no matter who they meet. When I speak with young people around, they have a difficult time imagining a world without mobile phones and without Wi-Fi. We have protected them so effectively against most communicable diseases that it's hard to take those diseases seriously. Measles, mumps, chickenpox, whooping cough, who knows? Today, the pandemic disease at the top of people's minds is, of course, COVID-19. For young people today, they have never faced a pandemic. While there have been 5 waves of pandemic proportions in the last 100 years, the last big one was in 1918, beyond the firsthand memory of anyone still alive. And yet the tools and strategies we need today to face COVID have been developed before. We've used these tools before. If we listen to history, if we learn from the way we've worked to eliminate things like smallpox and polio, then we can manage COVID and end the pandemic of our own lifetime much more rapidly. I asked some of the young people in our own local Rotaract Club at Boston University what they know about polio and about Rotary's Polio Plus efforts.
My current impression of polio is that it is a virus that can infect a person's spinal cord, which could lead to paralysis. I know it's transmitted through fecal matter and through droplets from sneezes and coughs. It's currently not in the United States, but it is present in other countries, especially Afghanistan, Nigeria, and Pakistan. But the possibility of transmission back into the United States could be very high if people aren't vaccinated. So if we stop inoculating our children of polio, it could rise again. So take a look at measles, for example. Several parents decided against vaccinating their children for measles. So many states saw a resurgence in the number of measles cases, which are directly linked to schools in Disneyland. So polio vaccinations are key to prevent this from happening in the United States.
For each of us, there are moments that define us. Moments where we fought for what we believed.
The moment Berliners have waited 28 years for.
When we pushed the boundaries to the unknown. Moments that remind us of a past we cannot accept, and that create within us the desire to take a stand and do something. 30 years ago, polio was claiming the lives of hundreds of thousands of children just like me. There was a vaccine that could help stop it, but it wasn't reaching all of us. until you decided to step in and do something. You decided to find a way to reach us all, no matter where in the world we might be. It all started with one small project, and 6 million children were saved from polio forever. The world took notice, and things began to change. On streets, on trains, planes, boats and bicycles, over deserts and rivers, mountains and valleys, through jungles and war zones, you never stopped. But it can't end here. We are this close, the closest that we've ever been. 3 countries remain, and we must continue to strive to reach every last child. Because every life truly does matter. And together, you have proved that when you put service above self, the world can be a much better place.
In order to reach every last child, we have trained and deployed over 20,000 volunteer community mobilizers. These brave volunteers, mostly women, are the backbone of the polio eradication program. They walk house to house daily, even in areas that threaten their own safety, to convince women and families to vaccinate their children.
Lafiyar al'umma haƙƙin kowa da kowa ne. This means that the health of the people is related to everybody. Everybody has to come and put hands together so that we should improve our health.
So what are some possible actions that people could take when facing a pandemic?
So one of the first steps that people should be taking is that they should be mobilizing their resources. This could be their emergency kits, non-perishables, anything so that they can be ready to be sheltered in place to stay as safe as possible. Another thing also important is that they should know where the disease or whatever that is causing the pandemic comes from. I think that if you understand why something is happening, for example, like the pandemic, you can be more at ease. And also another way to do that is to find some literature and to see what actions have been taken in the past and in previous situations so that we can avoid the situation getting out of hand.
Definitely. I feel like there are things with our current experiences with the current pandemic that might affect like how we might take action in the future. So I was wondering, like, how could we take some of the lessons we've learned or are learning right now and apply it to future pandemics or even to how we're trying to eradicate polio?
The first challenge to handling an outbreak of any disease is to identify what it is, how it is transmitted, and where it has been. This who, how, and where is critically important. It's now a scientific specialty called epidemiology, or the science of epidemics. It started with the work of John Snow to end an outbreak of cholera in London in 1854. Cholera is a disease that kills people very rapidly in only a matter of hours or days. When he heard about the first few cases in London, he swung into action. From prior experience, he had a theory that it was carried by water, not air. He studied who had it, where they lived, where they had been, and critically, where they got their drinking water. People did not have running water in their homes in those days. They drew water from one of a network of water pumps around the city. He mapped it out and looked for the nearest water pump. He talked with the families that had gotten sick and also with the nearby families who had not gotten sick. He got the city to remove the handle from the pump he identified as affected, and within days, the outbreak of cholera was over. Today, the Center for Disease Control sends a team of epidemiologists to study any outbreak of disease in order to contain it and to stop it. They've done this with salmonella. They did it with water problems in Flint, Michigan. That team is available and skilled and ready to work for us.
Well, I think one of the most important things that we learned from our experience with COVID is contact tracing. Contact tracing is extremely important because it helps us find out where this disease is coming from, or like which people may be most vulnerable to these diseases based on like maybe like where they live or where they visit. And I also heard that contact tracing was a big part of the Polio Plus initiative, because through contact tracing, they were able to find that there was a strain of polio in some of the sewer water in some of the inside the water system.
In 2016, after Nigeria was officially declared polio-free, 2 children from the Lake Chad Basin were diagnosed with polio. The children came from areas affected by years of conflict and large population movement. The global health community knew people had been living in areas inaccessible to vaccination efforts and hidden from surveillance teams. Genetic analysis quickly revealed that the polio virus had been circulating in the area undetected for 5 years. The science of polio surveillance must constantly adapt to pursue this virus. For most of human history, polio was largely invisible. Our ancestors could see fever, withered limbs, and paralysis, but not the invisible virus that was all around them. 3,600 years ago, Egyptians created a tablet showing a priest with a withered limb walking with a staff. And 1,000 years later, Greek physician Hippocrates described a similar paralysis of the legs. It wasn't until 1773 that the first detailed case of polio was recorded by Sir Walter Scott's childhood doctor, who described his symptoms as a teething fever. But Scott's own memoir documented something much worse: a permanently withered leg. Polio circulates largely unseen. Most people who are infected have no symptoms at all. Only a quarter of those infected will ever present flu-like symptoms. Only 1 in 200 will share Sir Walter Scott's fate. These acute cases are still important in modern surveillance systems. They are a good indicator of where the polio virus is circulating. Health workers in hospitals and clinics evaluate and report suspect cases. If the wild virus is identified, further tests are carried out to determine where the strain originated. In areas with few formal health workers, a parent will bring a child showing signs of paralysis to anyone, to find help. Religious leaders, pharmacists, traditional healers all serve as a source of information. In conflict zones, where there is no surveillance, health workers remotely examine children by video conferencing over a smartphone. Health workers also test those who flee to see if they are unknowingly harboring polio. This approach has had stunning effects in Pakistan, where cases have been reduced by more than 90%. Looking for the virus in humans is effective, but environmental testing can find the polio virus hidden in regions where there are no active outbreaks. In 2013, routine surveillance revealed polio in Israeli sewer systems. The government responded with a massive effort, immunizing 980,000 children in just 7 months. Not a single case of polio was reported. When Brazil hosted the World Cup in 2014, routine surveillance found poliovirus in a sewer system connected to the airport in Sao Paulo. Genetic sequencing traced the virus to West Africa. The traveler likely never knew they were carrying it. Brazil had ensured herd immunity through continued immunization, preventing an outbreak even while polio was circulating in the environment. Today, surveillance teams are using technology to search not just Nigeria, but the entire region to reveal where the virus may continue to circulate and threaten progress towards eradication. There are thousands of people involved in surveillance worldwide, working in the streets, in labs, health centers. Surveillance is the way forward. Eradication requires finding all traces of polio.
Surveillance of wastewater is a strategy developed to track polio, as you saw in the video clip. It is in use throughout the world to check for diseases that may threaten communities. It costs a lot of money to test every person in town, but by sampling the wastewater, you can measure the relative viral load in the community. In other words, how many people are pooping virus into the wastewater. This is especially important in diseases where people can get infected but don't get sick enough to slow down. Polio is one of those, and COVID is another one. Instead of testing every well-looking person to see if they might be infected, instead we can test the viral load in the wastewater to see whether we need to be more cautious. Just a few days ago, Boston alerted everyone that the viral load in the wastewater in Boston was high. In cities around the United States, from Boston, Massachusetts in the Northeast to Las Vegas, Nevada in the Southwest, scientists are working with public health officials to conduct wastewater-based epidemiology. Research early in the pandemic showed that people infected with the virus shed bits of the virus's genetic material in their feces. So by measuring the viral load in sewage, public health officials can get an idea of how prevalent the coronavirus is within a community. Combining that with other data, sewage samples can even be an economical way to determine whether a community is safe to open up or should consider restricting activities more. Dr. David Larson, an environmental epidemiologist at Syracuse University, has been working with his local health department in Syracuse, New York, to monitor the wastewater. He said to the Boston Globe, "Wastewater is convenient in that you can get a population level understanding of transmission in one sample. It's very cost effective. Tests employ the same kind of analysis as doing swabs, but instead of conducting dozens or hundreds of swabs and individual tests, a single sewage sample provides an overview picture of all the COVID activity in an area. If they do it in small enough settings, wastewater monitoring can even predict outbreaks. In one study conducted by researchers at Yale, fecal matter contained viral signatures about a week before the cases popped up. So a week's warning that you're going to have cases. Already, wastewater monitoring has been used to catch outbreaks amongst students at the University of Arizona and at Utah State University before they even displayed symptoms, potentially saving the university's hundreds of cases because they had time to implement quarantining strategies and reduce the number of transmissions.
The other most important thing about that we learned from this pandemic is also that is prevention. The best way to reduce the number of cases of a disease is just to prevent people from getting it in the first place, especially for things like polio that really can't be treated once someone is infected with it.
Our middle school is returning to hybrid school at the end of the month. We're told we need to check her temperature every day, but it seems there will be no testing at the school. Colleges are testing their students every day. Shouldn't elementary, middle, and high schools do the same?
I think in a perfect world, I mean, I think that's where the trade-offs come in, right? And, you know, Massachusetts is leading the way with the number of tests that we're doing per capita. But still, as a country, we're stuck around 900,000 tests per day. That number hasn't meaningfully moved in the last several months. There's been a lot of mixed messaging about the role of testing. So the supply hasn't increased to drive up the demand either. So I think that's part of the challenge. Now, the test alone is not therapeutic, right? I think the White House example from the last couple of days is a great example of that. So That doesn't mean that the middle school students are less safe than the college students, because the test just gives you the information. It depends on what you're doing. I'd rather have a middle school that has good masking, physical distancing, screening people to make sure there's no symptoms, doing that very, very robustly than a college campus that tests, but then people are going to parties. So I think that's, again, it's about all of the above. The testing is one piece of the puzzle, but it's not the only piece.
Why do you guys think vaccinations are so important?
I mean, I feel like vaccinations are kind of like the number one safe option that is like available to a lot of people. I think a big part of it is trying to achieve herd immunity. Like, for example, if 99% of the population is vaccinated, then there's that remaining 1% who probably can't get it or for some other reason. But then because most other people are vaccinated, they'll most likely stay safe. And I think that this is why it's so dangerous when people don't vaccinate their children. It's that, like, it's just so much more easily spread.
Do you trust what the FDA will come out with? Will you, in fact, if and when they recommend a vaccine as being safe enough and effective enough, will that be good enough for you?
I believe it will be. Obviously, as a scientist, show me the data. I want to see these data published. I want the public to have it, and especially scientists and physicians around the world to be able to look at it and form opinions of it. In general, I have been impressed by the process. It's a serious process, and I will trust the process, but not blindly. I'd like to see what the data look like. Those hearings, at least traditionally, have had a big component that are open to the public. So these are usually discussed in big chunks of it in public, and there's usually time for public commentary. That's at least the sessions I've been at. So I think it is a rigorous process, not a perfect process, because any human process is imperfect, because us humans are imperfect. And we're trying to do things quickly, much faster than ever before. Most vaccines have taken 10 to 20 years to develop. We don't have that kind of time. Now, they're scaling these vaccines, they're building them even before we know which vaccine works, which is also a challenge. So we're in a very delicate moment. On the other hand, as the process as I've traditionally seen it played out, I do believe in, and I am cautiously optimistic that it'll be the proper process this time as well.
Given everything that you've learned from polio, and given that we don't have a vaccine yet, what is the one most important thing that you think needs to be done right now to fight the coronavirus?
Personally, I think the one most important thing is for everyone to stay safe. Follow the advice of the CDC. Secondly, don't rush a vaccine before it's ready. We have a new vaccine coming out to deal with something called vaccine-derived polio. And it's been under study, funded by the Gates Foundation for 10 years. We applied for the first ever early use license from WHO. It's taken over a year and we still don't have it. So, don't put something out there that is going to be a public relations disaster. Make sure it's safe and it's right to the greatest degree possible before putting it out there.
Thank you.
The third thing that I guess we learned from this is just how important sanitation is, wearing masks, washing hands, all of that stuff. Yeah.
Welcome to our panel. I know your schedules are incredibly busy. We really appreciate the time you're giving us today.
The polio infrastructure that Rotarians helped build with partner agencies have really played an enormous role in protecting vulnerable communities from COVID-19. What aspects of the polio program and its infrastructure have really been most helpful in fighting other diseases like COVID-19, Ebola, and yellow fever?
When there's an emergency, when there's an outbreak of yellow fever, when there's an outbreak of measles, they pitch in. They put their shoulder to the wheel. They take what they've learned from doing successful polio campaigns that have to reach all the children in the village, and they apply that to reaching them with yellow fever or measles vaccine.
When you have someone in a village who can identify if a child has polio or has Ebola or yellow fever or COVID and knows what to do about it, can help the parents know what they should do, this is a great gift to a community.
The surveillance system and laboratories that have been built that have allowed us to detect and to be able to test for Ebola or yellow fever. The ability to be able to use the laboratory and the knowledge of the laboratorians in countries that capacity has been built, and the people, the surveillance officers in the field who have gone out to find cases, who found contacts, and who have done the tracing that is needed.
The network, the infrastructure we built through polio in terms of how to engage communities, how to work with communities, how to rapidly teach communities to actually deliver health interventions, do disease surveillance, et cetera, has been extremely important part of the effort to tackle so many other diseases.
Since 1985, Rotary has been the foundation on which the polio eradication program is built.
Last year, we saw just 37 cases, the lowest number in history.
Thanks to your efforts, more than 16 million people are walking today who would otherwise have been paralyzed.
Thanks to your vision, humanity is on the verge of one of the greatest public health achievements in history.
While our work is not yet done, the remarkable dream that you had 3 decades ago to tackle one of the world's greatest public health challenges, the end of polio, is nearly a reality.
Thanks to you, we truly are this close to ending polio.
Thanks to you, we are truly this close to ending polio.
We are this close to making history, this close to changing the world. We are this close to making sure no child suffers from this devastating disease ever again. We are this close to ending polio. All we need is you.
We are this close.
We are this close.
We are this close.
This close to making history.
This close.
We're this close, this close. We are this close.
We are this close.
This close.
This close to changing the world.
We are this close to making sure no child suffers a crippling disease
ever again. We are this close to making history.
We are this close to ending polio.
We're this close to ending polio.
We're this close.
This close.
This close to ending polio.
This close.
We are this close to ending polio. All we need is you.
All we need is you.
All we need is you. Is you.
All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolio.org.